Hello, this is Dr. Lewerenz at Longevity Health Institute here at the end of my day, late February, and I want to give you 2022, I should say, and I want to kind of give you a little check-in and check-up with something that we work on in our model here all the time, and I probably have neglected it here on the YouTube channel, but not neglected in our office or our patients, but in me and my providers are very, very, very vested in this and follow a lot of this stuff, and that is hormones and how important hormonal balance is. And I get a lot of questions all the time. Had a patient today, a new patient that actually came in and had a lot of questions about, they actually were on hormone replacement and actually, yeah, it solved some things, but hormones are always about balance. So let me back up here a second and I'll explain a couple things. So in a functional model, in a wellness preventative model, you cannot bypass the use and balance of hormones regardless of age if you want to be healthy and age gracefully and actually be thriving, not just kind of lingering, if you will, and surviving. If you want to thrive and feel good and function good at work, at home, and with loved ones, etc., you got to be hormonally balanced. And that's so key. Now at the end here, I'm going to go over some symptoms that people have, whether they're treated or not treated, because hormones are always about the balance. And when you get out of balance, things get a little bit off and many things can start to happen. But in a good way, hormones are very, very strong and powerful when they're done right and done in a balanced effect, okay? So we always start from our foundation. You guys heard me talk about this before, but hey, what do I teach you is just to make sure that you always incorporate this in your lifestyle, and that is a health foundation. It's got to be, good gut, good diet, good exercise, good movement. There's a new study actually that came out that is very interesting about people and how much they're sitting nowadays versus standing and walking. And yes, standing has a lot of benefits over just sitting, but the interesting thing about that study is that it compared to how many weeks and months that they did this and then how their body got adaptive. So we always got to challenge the body and be adaptive so that we can actually get a change. If you don't change, you're not going to change, if that makes sense. Meaning if we're not going to change some activity or change some part of your diet or change some part of, how many calories you burned, you get adaptive. That's what our bodies do. They're very adaptive things. So long story short is just sitting, obviously not good. Standing better, but if you are standing because of work and that, you need to actually not just accept that, but in months to come or part of your lifestyle, you want to make sure that you're walking more, moving more, and if you walk, whatever your baseline is, you need to advance that occasionally and alter it. And this is why it's so important. And our trainer here in the office that works with nutrition and training is wonderful with this, Victoria, that's out there, and you've seen, because here's the thing is that you have to modify your program to shock the body, okay? But anyway, we start from a health foundation here, right? And then I'm gonna get back to hormones, but we start from a health foundation, always considering genetics, how you detoxify, your diet and gut health. Do you have a lot of stress in your life? Obviously, a lot of us do nowadays. Gosh, man, anxiety and mood, crazy out there in our office. And it's realistic. I mean, it's expected. Why? Because what we're living in and the climate and all that. But the reality is that is a big hit to us right now. But mind and body, mindset, mental health, etc., very, very key. The other thing is hormonal balance, very key. And then we always appreciate structure. People sometimes don't understand what I mean by structure, but you can never ignore something that's structurally off, whether it's your spine, whether you have a structural problem with the heart, whether you have a structural problem, with, a joint, if you will. You can't always fix everything, but you have to appreciate the structural issue that's going on there so that we can, for instance, understand physiologically what we have to do here at Longevity Health Institute and from a functional personalized approach to get you better, if that makes sense. So structure is important. But here, back to hormones. So we always want to make sure that foundation's good, but one of the key things is so important is hormones and hormonal balance. And in fact, balance is probably the thing that I see them miss the most. And I'll even tell you a little story today about a patient I saw where their hormones were just a little off, okay? And hormones were replaced in this patient. They were appreciated from another practitioner, and I think they were doing okay, but it wasn't tested right. We're really big on saliva testing or urine testing. Blood testing is okay, but it is a moment in time, and you have to really clinically know what you're looking at. Saliva testing for your sex hormones and your adrenal hormones, and I can't say enough about adrenal hormones because nowadays, tons of adrenal issues here. That's why half our IV room is full all the time, because people have significant adrenal fatigue and need to be recovered, and not just from what's going on in their stress and their life and their work and whatever, but post-COVID, we see it all the time. There's studies on that actually the adrenal gland, actually the virus hits the adrenal gland, and we see numbers really tank and crash, which creates brain fog and fatigue and everything. But hormonally, all your hormones matter, okay? But it's so important to make sure that you're dialing in from a balance standpoint, okay? Anyway, we like to test saliva, urine, blood's decent to get a picture. But to make sure you're balanced at a tissue level, at ratios, you need to test saliva. So, but hormonally, here's the big thing is, symptoms and problems that we see when people are not balanced hormonally. And this could be in your late 30s to obviously 50s and 60s in menopause, or a man in andropause, okay? By the way, so important, studies came out about this in women, okay, have a stronger immune system and less infections, okay, specifically one that's going on right now, when they were on estrogen replacement, postmenopausal. And they actually studied this. It was a peer-reviewed study. They studied this, women on hormones and women not on hormones. And it was pretty dramatic, the results. But anyway, so, your age makes of no difference. You could have somebody in their early 30s, mid 30s, starting to have a progesterone decline from stress and adrenal issue. They could also start to have an imbalance in high or low testosterone, okay, or unappreciated, like a PCOS, which causes high testosterone, hair loss, anxiety, palpitations, okay, and restlessness, things like this, disrupted sleep, okay. But it's not uncommon for somebody to get a slight decline in progesterone in their 30s, especially mid to late 30s. 40s almost a guarantee, and it may be a big issue that's affecting anxiety, sleep, hair, libido, weight, and many things. Plus progesterone, we call it the feel-good hormone. I can't tell you how many women here, how many patients here with myself and other practitioners literally come in and could hug us afterwards because their progesterone is balanced with other hormones all of a sudden, and things are smooth. They have less anxiety, they're sleeping better, their mood's better. They're in fact, I think today one of my patients even said something like, they're so happy they're not just irritable and angry a lot. Their mood is just so much better. But that could be said for many hormones. I've actually seen that in women in testosterone, where their testosterone is low and lower than it should be, or it was for them maybe 10 years ago. And when you get their testosterone dialed in for them, a very personalized approach for them, then they're smooth, they're happy, their mood's good, everything's good, libido's good, and everything. So point being here is that hormonal balance is so key. Now, common symptoms in that, again, progesterone deficiency, going to be hair loss, libido, anxiety, poor sleep, and a few others, okay? Weight gain, okay? When you start to lose estrogen, one of the first things that happens, and I mean it's not every month, but the first things that happens is not a little bit of inflammation and immune response, but actually vaginal dryness and uncomfortable or bothered intimacy with your partner, okay? And yes, it's not horrible and it may not be every month, but as you lose that estrogen, you start to get this effect. And that is so important for quality of life. Relationships and intimacy, etc., are so important for quality of life that literally I can't talk about it today, probably talk about it a handful of times a week with patients, is that so important, and that is usually the early loss of estrogen, okay? Now, as you get later, your hormones get dysfunctional into, perimenopause and menopause, which is usually not just a progesterone decline, but a significant estrogen decline, where you start missing periods and technically start getting into menopause or full, postmenopause. And that can be a plethora of symptoms: weight gain, inflammation, immune issues, mood, depression. Actually, interesting, blood pressure typically goes up. One of the things estrogen is great for, you probably heard in other videos, it keeps your arteries more flexible. It keeps them, moving. The endothelium are much better. So very, very important in that aspect. But bone health and brain health, memory and bone mineralization, so that your bones stay good and strong. So important, okay? So hormonal balance is so key at these different stages. Now, those are your sex hormones. At any age, you can have an adrenal hormone issue, especially post-infection and a lot of stress and not sleeping and exercising too much. So you have to appreciate those. And I can't say enough, and I got full videos on this, and that is thyroid. When you get your thyroid evaluated, you need to make sure that practitioner is looking at the whole picture. Antibodies, your free T3, your free T4, where your thyroid is in that spectrum. And by the way, if it's low, it may not mean you need thyroid. It may mean, based on those numbers and other things we look at with your diet and gut health, is that you need some supplementation correction of your diet and gut health, maybe iodine, maybe iron, okay, minerals. And these are things that support the thyroid, okay? So again, you have to see this whole picture of balance. When things are in balance, things tend to be perfect, okay? So that's very common, very, very typical here, and probably haven't talked about it too much here, but here at Longevity Health Institute, we always are looking at you hormonally for prevention and restoring your goals and why you came in. But long term, when you have that dialed in, there's nothing better. And this is men too, by the way. I guess I haven't talked much about men, but this goes for men too. Sex hormones in men, can't tell you how much from an energy, mood standpoint and all that. But remember our 6-point model. Remember, you got to look at all these things, make sure they're balanced well. And very commonly, and we'll be talking about this more and more in what's going on in the world, with our pandemic and COVID and all that, we're seeing some of these things get all messed up, whether it's early menopause, infertility, earlier perimenopause, adrenal dysfunction, thyroid issues, autoimmune issues with your thyroid like hypothyroid, Hashimoto's. So these are all happening, and sadly happening more and more. In fact, there's some articles out here about the coming years of our morbidity, meaning our illness in the world and in America. It's going to skyrocket, and it's not good as it is right now. So this is why you need prevention and wellness and a personalized approach. So come see us. We're always taking new patients and have wonderful practitioners here that look at you from a very holistic, personalized approach, and happy to see you and bring you the best in functional personalized medicine. This is Dr. Lewerenz. Reminder, 2 locations. Our new office just outside of Birmingham, Bingham Farms at 14 and Telegraph, and full IV suite, full beautiful facility, state of the art, just like we have here in Rochester Hills. Same thing here, and 2 locations to better serve you. Me and my practitioners are happy to assist you in your health and needs. This is Dr. Lewerenz. Be well.